In this video, we're going to look at sciatica, in particular Piriformis Syndrome, or sciatica because of the piriformis muscle. The sciatic nerve is the largest nerve in the body. It comes from our lower backs, it runs through the buttock or through the glutes, all the way down our legs into the sole of our foot. People with sciatica can struggle with pain within the glute, or pain, burning or tingling all the way down the leg. Most people get it within the foot, so like a burning sensation of your foot can be sciatic pain. For this, we're going to focus on a muscle called your piriformis. So the piriformis muscle runs across our glute, so it runs outwards, and the muscle, or the movement it does is abduction of the hip, especially when the hip is in a flexed position. The reason piriformis can kick off the sciatic pain is because the sciatic nerve runs very, very close to that piriformis muscle. In around 10% of the population, it actually runs through that muscle. So if that muscle becomes tight or it becomes a little bit unhappy or inflamed, it will start to put pressure on that sciatic nerve, which will then kick off anything within the glute or anything further down the leg, that burning sensation that we were talking about. So for this exercise routine, we're going to focus in on moving that piriformis muscle, getting that sciatic nerve just to loosen up a little bit. So what we're going to do is start on our front, and then from here, all we're going to do is just go up into a seal pose. So we want to push our bodies up, try and keep our hips on the floor, and just get movement into that lower back. If you get extreme pain here, or you get a sharp stabbing pain in your back, stop immediately. And it'd be worth getting in touch with your GP or someone like myself. It could possibly be something to do with your discs in your lower back. If you're okay doing that movement, then carry on with this routine. So we're going to keep our hips down onto the canvas or onto the floor. And again, we should feel that stretch into our abs, and then you shouldn't feel any pain or sharp pain in your lower back. Relax back down and then repeat. So go up, and then when we're here, try and keep breathing nice and slowly, and keep that hip relaxed into the floor. And relax back down, and then we're going to go once more. So relax, let your torso relax into the floor, and then push it up once more. Getting the arms nice and straight, keeping the hips into the floor. Okay, and relax back down. From here, we're then going to go into scorpion kicks. So all we want to do is bring our legs over and get it to touch down onto the floor. And again, we should feel that a little bit in the glute, a little bit in the lower back. Try and keep your upper body as flat as you can whilst you do this. And again, going round that way. And relax back to the middle. If I show you from the front, so you can see what happens to my body. So as my leg comes over, just getting rotation into that lower and that thoracic spine. And again, nice deep breath, relax whilst you're into the stretch. Just feel it go a little bit more. Okay, and then we're going to repeat that 3 times. So we go back into this position, and I'll go once more. And again, we want to hold it for 4 to 5 seconds and really relax when we're there. Just relax into the stretch. Back to the middle, and once more with my left. Again, you shouldn't get any sharp pain doing this. You should just feel it stretch around your lower and thoracic back. Okay, from here, we're then going to roll onto our backs, and you want to just allow yourself a deep breath and just let everything loosen off, and then bring one leg up. So I'm going to start with my left, and then I want to just grab around and cuddle that into my chest, and I should start to feel it pull on the glute. Once I'm comfortable there, I'm just going to start to bring that across to the opposite shoulder. So my left knee is going towards my right shoulder, and as I bring it across, I should feel the stretch move more towards the outside of the glute as opposed to the bulk of the glute. Again, by doing that, if we think lateral or abduction, there is the movement the piriformis does. By doing that, we're then getting on stretch. We're doing the opposite movement. And then just relax that one down. Give yourself a little pause and rest in between, and then bring your right one up Go down. Normally people suffer with sciatica only on one side. It can be from lack of movement around the SI joint as well, so it's really important to do both sides. Make sure your hips are nice and even and moving well. And again, you'll feel a difference. One might be a little bit tighter than the other. So I'm just bringing my knee slightly further across towards my opposite shoulder, and I can just feel that moving towards the outside of my glute. And relax down and then repeat back on the other side. Little rest between, and then pull in, and then move across. Try and keep everything else nice and relaxed when you're doing this, so no stress through your lower back. Keep breathing throughout, which will help or stop you from stressing up and contracting certain muscles. And then going to relax down and swap. Okay, and back to our starting position. The next movement we're going to do is very similar, but this time we're going to bring our leg up and we're going to go all the way across and just allow our lumbar to rotate. Try and keep our shoulders on the floor. Take that foot out to the side. We can just use our hand here to push our knee into the floor. And again, we should feel that opening up the hips. We should feel that in our glute. Little stretch to the lower back as well. Again, you shouldn't get any sharp pains doing this. It should just feel like the glute is nicely on stretch. Hold it for a few seconds. Nice deep breath, relax into the stretch. Back to neutral and repeat with the other side. And again, this time we can just use our right hand to pull that knee down a little bit. As we do that, we feel the stretch a little bit more just on the side of our glute. And it will also pull the lumbar around a little bit more as well. So if we think the sciatic nerve comes out from here, so we're just trying to get those muscles in there to loosen up as well as that piriformis muscle. And back to neutral, and then again we're going to repeat the same. We should feel ourselves a little bit more comfortable and be able to stretch a little bit further the second time we do it. Into the stretch, deep breath, and hold for 3 to 4 seconds. And then back to neutral and swap over. And then back to the middle. From here, we want to stay in the lying position, drop both of our legs down. Again, just allow everything to relax into the floor, a couple of deep breaths, and then one at a time, I'm going to bring my left leg up so it's opposite the knee, and then from there, I just want to tuck my foot in to my right knee in this case, and then just drop that down. So drop your knee all the way to the floor. Make sure that the sole of your foot is pushed against your right knee. And again, you just feel that opening up the hips. So this time we're feeling it more from our abductors in the inside of our leg, just here. And then bring that up to the middle, and then just drop it back down again. Once we're there, nice deep breath, and just allow our bodies to get used to that position and relax into the stretch. So a couple of deep breaths, and then come back up to the middle. Swap your legs over, so drop your left down, bring your right up. Again, your right foot is going to go against your left knee, and then just drop your right knee down towards the floor. As you do that, the sole of your foot then comes against your knee. And you will feel one side tighter than the other. Back to neutral, and then again, just drop that down. Similar to when we were moving our leg across, if we want to, we can just place our hand on the inside of our leg and just push it down a little bit more to extend that stretch. We're not forcefully pushing it, we're just helping it go beyond its passive range. And we're feeling that in our adductors, just allowing our knee to drop down towards the floor. And then back to the middle. The next exercise we're going to do requires a little ledge, so something like a sofa, something like a seat, the kitchen side, depending on how flexible you are around your hips. All we're going to do, and again we're going to do both the same movement on both of our legs. So I'll start with my right leg coming up, so I want our leg to go up and out sideways onto the box. and relax down. You should feel a little stretch on the outside of your hip in this position. If you can't get your leg flat onto the surface, lower the surface slightly. So again, whether it's a chair or go onto the sofa. Once you're in that position, you should feel a little stretch, and then all we're going to do is just drop our standing leg down, and by doing that, we're just increasing the stretch. So this is a slightly different stretch to pigeon pose. Same position, but just a slightly alternative way of doing it. And keep relaxing into that stretch, and again, just feel it increase on the outside of our hip. And we're going to come up, nice and relaxed, little pause between, and then again, just drop down into that stretch. We shouldn't be feeling any sharp pains here. We'll be getting a little bit of soreness in the glute where it's a bit tight. But again, it shouldn't be kicking off any sharp stabbing pains. Swap your legs over. So again, we're going up and out with our knee. Make sure that our leg is flat on the surface. And then again, feel a little stretch just in the glute, and then drop down. Feel a little bit tighter on the side, and again, we're feeling it on the outside of our glute. Really getting that piriformis to stretch out. Pause in between, and then again, just get back into the stretch. And each time we do that, we should feel it a little bit easier. 2 more exercises to do. So all we're going to do for this next one, you can do this banded, or you can do it against a wall. To start with, we're just going to bring our leg up. So if you want to use something to balance on your other leg, that's fine. If you can do it without, again, also fine. We're just going to bring our leg up so that we're flexed at 90 at our hip and also at our knee. And then from there, we just want to move our leg outwards and try and keep the hip up. So as we move out, we don't want our leg to drop. So again, the piriformis is doing that for us. So it's in hips in the flex position, and then we're just moving our leg out like that. If we can do that resisted, so again, we can band around our knee or we can push against the wall, then that will help. So if I show you with my right leg, so I'm going to come up against the surface here, and then I want to just try and push away against the wall like that. Again, just getting that muscle to contract. So up to 90 at the hip, 90 at the knee, and then just push into the wall. You can do it with your hand as well, so you just push into your hand there, and you should feel your glute working. Okay, and then again, repeat twice on each side, and then swap over. So bring your left leg up, and push out towards your hand or towards the wall, and then go again and push out towards the wall, and then back onto standing on our left, working our right. Again, push out and relax, and push out and relax. Just trying to restore the muscle function and the strength in that piriformis muscle. The last exercise we're going to do, and again, you can do this sat on the side, you can do it sat on your bed, you can do it sat on a chair. You can use the Swiss ball for this. All you want to do is sit in a nice slouched position to start with. So place your hands backwards on the couch and then just relax down. So bad posture, and we're just trying to get that stretch through the sciatic nerve. So slouch down a little bit. Drop your head down to start with, and then just slowly bring your leg up. And you should start to feel a stretch along the back, sort of through your hamstring, around the back of the knee. You possibly feel that a little bit in your glute as well. And then once you're comfortable from there, you can lift your head up. And as you do that, lift your leg up, and then again, just drop down. When you get to the end of it, it'll feel like a piece of string is pulling behind the back of your leg. That in effect is your sciatic nerve. So we're just trying to get a glide through that sciatic nerve. So again, bring your leg up and then drop your head all the way down. Repeat 2 or 3 times. And then just raise the foot slightly. If you want to put the foot up onto a surface or have something down there, so again, put it on the back of a chair, have someone hold it for you, then that also works quite well as well. If you can't feel it pinch, you'll either need to go a little bit higher with your leg, or just exaggerate the flexion in your spine and drop your head down. Again, do the same on both so you can feel the difference. So leg out in front of me, nice and slouched, dropping my head down. And just feel that piece of string pull behind the leg. You can also do that sat in the corner of a room. So again, if I show you from here, you can sit right in the corner, get your bum as close to the edge or where the corner meets, and then from there you can do both at the same time. So again, hands backwards, slightly slouched, and then just drop your head down. and you'll probably feel that on one more so than the other, possibly in the leg that you're struggling with. Just slouching down, feel that a little bit in my lower back and going through the bottom of my legs as well. That routine is really, really good if you have been struggling with sciatic pains, numbness or any tingling in your feet or in your legs. Some people get it through the shins. If you have a severe pain within the buttock as well, so if you're trying to sleep at night, you're finding that one glute is really, really tight and sore, that routine will really, really help with it. Hope you enjoyed that video. I hope those exercises really do help with that sciatic pain that you've been experiencing. Keep your eyes peeled for more content, and thank you for watching.